The elbow is an evolutionary adaptation that allows the hand to move away from and towards the body. This video will dissect the four major components of the elbow joint. The major bones involve the articulations of the bones, the ligaments involved, and the muscles responsible for movement. Three elements will be attributed to each quarter of the overall structure, defining the form and function of this joint. The elbow, which is only found in primates, provides a range of motion through a complex joint structure. The elbow joint is a diarthrotic joint, meaning it is freely movable. All diarthrotic joints are synovial joints. A synovial joint is named for the fluid that lubricates the joints. The joint is composed of two structures. The joint capsule joins the bones with an avascular white fibrous tissue. The capsule has two parts. The outer or superficial layer is called the articular capsule, and it holds the bones together. The deep or inner layer is called the synovial membrane. This synovial joint is primarily a hinge joint, meaning it allows flexion and extension in one plane. This ganglymus, another name for hinge joint, provides for extension or straining of the limb and flexion or bending at the joint. The elbow joint is actually a complex joint combining three separate bones. The proximal bone is the humerus. It joins the elbow at the bone's lower extremity. The elbow joins the humerus with the two bones of the forearm. The radius or radial bone extends from the lateral side of the elbow to the thumb side of the wrist and runs parallel to the ulna, which exceeds in it in length and size. The ulna parallels the radius and in anatomical position is on the medial side of the forearm. The olecranon process of the ulna fits into the olecranon fossa of the humerus. The ulna also has a radial notch for the head of the radius. Because there are three bones forming the elbow joint, there are 3 points of articulation. The first to be examined is the humero-ulnar joint. This articulation is a hinge joint between the trochlear notch of the ulna and the trochlea of the humerus, providing flexion and extension of the bones. The humeroradial joint is a ball and socket joint, connecting the head of the radius with the capitulum of the humerus. This connection allows the distal bone, the radius, to move in multiple axes. Lastly, the superior radial ulnar joint provides movement between the head of the radius and the radial notch of the ulna, allowing the radius to rotate along with the hand from pronation and supination. Ligaments of the elbow joint hold the bones together and limit the amount of play in abduction, adduction, and axial rotation. There are three main ligaments that transfer the axis of the joint. The medial or ulnar collateral ligament complex has two separate bands, the anterior and posterior bands. The anterior band attaches to the medial epicondyle at the proximal end and attaches to the coronoid process at the posterior band. The posterior band attaches at the medial epicondyle and continues to the olecranon. The radial-collateral ligament connects the lateral epicondyle to the radial notch of the ulna. Lastly, the smaller oblique cord runs from the tuberosity of the ulna to an attachment just distal of the radial tuberosity. Three main muscles provide flexion for the elbow joint. All three muscles are used during rapid and forceful flexion. The brachialis is the elbow flexor and is one of the few muscles in the human body with a single function. This muscle originates on the anterior side of the humerus and inserts on the tuberosity of the ulna. The brachioradialis muscle offsets extremes in pronation and supination. When the forearm is pronated, the brachioradialis supinates, and when the forearm is supinated, the brachioradialis pronates. But mostly the brachioradialis acts as an elbow flexor. The brachioradialis originates at the lateral supracondylar ridge and inserts on the radius at the styloid process. The main flexor of the elbow is the biceps brachii. This two-headed muscle also supinates the forearm. It originates in the scapula and has a main insertion point at the radial tuberosity of the radius. The elbow joint is thought of as a single joint, but it is actually a complex system of 3 points of articulation with 3 bones. Three main ligaments hold the bones together, and three primary muscles provide movement for the hand and arm.